Now, if you've had an itchy groin or a rash anywhere on your body that looks like this or this, then by the end of this video, you'll learn exactly what it is, how you might have picked it up, how we as doctors diagnose it, what treatments get you the best results, and most importantly at the end, things you need to do to make sure it never comes back. And of course, these images are showing a type of infection called ringworm, but let's be really clear. Ringworm has absolutely nothing to do with worms. I know sometimes medical names can be false advertisement. Ringworm is actually a type of skin fungus called dermatophyte, and they love warm, moist environments, basically the fungi equivalent of being on a luxury tropical resort. These infections can cause red, itchy, circular rashes that can appear anywhere on your body. But the most common all-inclusive hotspots are your groin, your armpits, and under your breasts if you've got breasts. And if it's left untreated, it can hang around for weeks, months, or sometimes even longer. So how do we catch it in the first place? Well, you catch ringworm through close contact with somebody who has ringworm, or you've touched something that's been contaminated by them. So here are some examples of how you can catch ringworm. Direct skin-to-skin contact, so shaking hands with somebody who has been scratching their ringworm, and that's not a euphemism. Petting infected animals, and yes, unfortunately, our furry friends can also have ringworm and can infect us. So if you've got a pet that's got patchy little bit of fur loss, then they could have ringworm. Touching contaminated objects like towels, clothing, bed sheets, that can also transfer ringworm to you. Walking barefoot in swimming pool areas, shared accommodation, showers, basically anywhere where lots of people are walking around. And very rarely, you can also catch it from soil. I don't know why. You can apparently just get it from soil. Don't roll around in soil would be my tip. Now, skin rashes can have a number of different causes. How do we as family doctors diagnose it? Well, rashes are very visual. So first of all, we're looking for something that's circular, red, scaly, and it's got slightly raised edges at times. Rings that often expand over time gives us a clue that it's spreading. And also you might have skin that is red, inflamed, or cracked at the center of the ring. And also let's not forget, the main symptom tends to be an itchy rash, so people often are itching it and it's a little bit irritating. Now, something that I often don't see talked about but is very important is that it looks very different on different skin tones. So from my experience, on white skin, it can look more red and it's more easily noticeable. But on darker skins like myself or somebody who's got black colored skin, well, it is a little bit more subtle. And ringworm may actually look darker, so the circles could look darker. You can also get slightly raised and flat edges on them, and you can also get a scaly appearance on them. I'll put some images here, and obviously if any of these look familiar, then you should probably have a chat with your healthcare professional. Oh, before I forget, the other part is that if you get ringworm that spreads to your scalp, you will notice some patchy hair loss because the areas that the fungus is affecting can damage the hair follicles. Obviously, once you treat the ringworm, the hair can regrow, and on your feet, ringworm is called athlete's foot. You don't have to be an athlete to get it. You often get peeling, cracking of skin, and often treatment will make that better. So when it comes to treatment, the good news is ringworm is treatable. For mild cases, I often go for antifungal creams, and you can see a list over here. You can buy them over the counter. You can go and have a chat with your pharmacist. And the one I think I commonly use is clotrimazole. You apply it 2 or 3 times a day for about 4 weeks, and that often clears it. Now, importantly, sometimes people stop using the cream as soon as the rash goes away, and then they come back a few weeks later and they say, "Doc, the rash has come back. I treated it. It's not working." It just may mean that you may have stopped too soon. So you need at least a couple of weeks of treatment. So you may need to continue for a short while after things have resolved, but always check what the recommended length of treatment is. And for severe or persistent cases, especially affects the scalp or nail infections, you might need a prescription of medications that are far stronger. And I would say have a chat with your healthcare professional. And for people who have very large patches or recurrent where the infection keeps coming back and they followed all the advice, well, you may need more investigations. And I'll talk about this a little bit later at the end. Sometimes I speak to patients with ringworm who are very embarrassed about having it, and that's understandable. They say, gee, doc, I shower every day. How can I have this condition? Well, remember, ringworm doesn't mean that you're unclean. It just means you came into contact with someone who had it and passed it on. And it's a very common infection in the community. And now that you know how to treat it, how do we stop it from coming back or spreading to others? Well, firstly, I would advise keeping your skin clean and dry, so wearing loose-fitted clothes made of cotton or material that's designed to keep moisture away from your skin. Remember, the more sweaty, moist environment there is, the more it grows. And don't share personal items like towels, hairbrushes, or clothing.
Hey, why can't we use the same toothbrush, but we can use the same soap?
Because soap is soap. It's self-cleaning.
All right, well, next time you take a shower, think about the last thing I wash and the first thing you wash.
Make sure you wear flip-flops if you're going to public showers in swimming pools. Change your socks regularly and boxers regularly, knickers, whatever you like wearing. And wash your hands regularly as well. That's really, really important, especially if you've got pets who may have ringworm as well. And on that note, make sure you check your pets because they could be spreading the ringworm to you. So if you think they've got it, maybe worth visiting the vet. And a super important don't is avoid scratching the areas if you can. This can spread the ringworm into your fingernails and other parts of your body that you might also scratch. And sometimes infections in the household may clear from one person, but somebody else may have it and then it comes back. So it's worth keeping an eye and track of anybody else in your household who may also have the infection. Now, while most cases of ringworm can be mild and it can be treated at home, sometimes you need to see your doctor. And I would say this would be the case if you've tried over-the-counter treatments, so your antifungal cream, and you've followed all the instruction and you've given it a couple of weeks and it hasn't really resolved. If the infection is spreading or is very severe, very angry, and it's very painful or itchy. If you have ringworm in your scalp or nails, remember, you may need a tablet or you may need shampoo treatment. If your immune system is weakened due to other health problems, or if the areas look very, very painful, swollen, or oozing with gunk, that often means you can get a superimposed bacterial infection as well. If you keep getting ringworm infections time and again, there may be an underlying medical problem. So click on this next video to find out all of the skin signs of diabetes. Because if you're diabetic and you don't know about it, then you're more likely to get these kind of skin infections like ringworm that keep coming back after treatment. So see you on this next video. Peace out.